Hi, I'm Dr. Baxter. It's such an honor and a privilege to serve you and your family. Today we're going to talk about tongue tie treatment for children and adults. So here's my family. There's my wife, Tara. Our twin girls, they're older, Hannah and Noelle, and then Molly is there in the middle. So all three of them had tongue ties. I actually had a tongue tie myself and didn't know it, so I had mine fixed when I was 30, but it can make a big difference, and so we're going to talk about that today. So a few basics real fast. A tongue tie is a too tight, thick or short webbing of tissue from fetal development under the tongue that restricts normal tongue movement and causes a functional issue. So it has to be causing a problem. And the symptoms the child or adult has are more important than the appearance. So a full assessment of related issues is really the key to diagnosing a tongue tie properly. So having the patient stick the tongue out is the worst test to determine the presence of a tongue tie. Elevation or lifting the tongue is the best test, because that's the critical movement for the key activities of nursing, swallowing, speaking, and proper tongue placement during sleep. So if not assessed properly, they can go undiagnosed for years or even decades. So for assessing children, again, symptoms and function are more important than the appearance. So like the one on the left there is really tight, that's going to be causing a problem. Surprisingly, even the one on the right, the floor of the mouth is lifting up a lot. That child had autism, but they're also nonverbal. And after we released their tongue tie, they started talking afterward. And so any appearance can, there's the tightest to the most minimal. It depends on how many symptoms they have, and then as well as how tight it is and then how it looks. And again, how high you can lift it up is much more important than how far you can stick it out. Here's some examples of lip ties as well. So lip ties is basically the same thing up on the lip. It's a piece of tissue from fetal development that should have gone away that didn't. And so it can lead to cavities, it can lead to trouble with like a gap in the teeth, trouble brushing the teeth, cosmetic concerns. It can even impact nasal breathing, making it harder to breathe through the nose. Lip ties can cause lots of issues. We release those all the time, and they very often, but not always, go together, lip tie and tongue tie. But there's a lot of myths and misinformation about tongue and lip ties, like they don't exist, oh, it's not a big deal, they don't cause problems, it's very rare. In a study at our office of our hygiene patients, the dental patients, after we looked to see, what their tongue looked like and asked mom about the symptoms, about 25% of them, or 1 in 4, realized, hey, like Johnny's tongue is a little bit too tight, I think we should get him checked out. So it's probably closer to 1 in 4 rather than like 1 in 100 or something. So it's actually extremely common. Also, people say, oh, well, it'll stretch out. The child will fall and rip it. That's not true. We see adults. One of you might be an adult here. We see adults with tongue ties. We see older kids with to-the-tip thick tongue ties. And although you can fall and rip your lip tie, it is very difficult, almost impossible, to rip the tongue tie. People say, oh, I snipped it with scissors, or maybe yours was clipped, or your child's was clipped at birth with scissors and it grew back. Or if stretches are not done properly, it can grow back too. They'll often say, oh, the baby will need general anesthesia or child will need sedation to have it done. That's not true. We can do it on any patient. We've not met one yet we couldn't do without using sedation or general anesthesia. Often babies will have nursing difficulties that aren't resolving. Kids will have issues with speech or eating or sleep that have not resolved even after years of speech therapy, still struggling. Mothers are told it's their fault. You may have been looking back like, oh yeah, like, oh my gosh, my baby was such a struggle and they were colicky and a difficult baby and you didn't get help. And so there's all kinds of issues that can happen from a tongue or lip tie. And so some of these might be the reason you're here today, but speech delay, trouble with sounds, R's and L's and S's especially, trouble eating solids, so slow or picky eating, choking, gagging on foods, small appetite, airway issues like mouth breathing, snoring, large tonsils, development of the sinuses, poor sleep quality, so teeth grinding, restless sleeping, sleep apnea, poor behavior can stem from that, even ADHD, where they get real scatterbrained because they can't focus because they're not getting high quality sleep. And it can also affect brain development. Poor dental development, so high arch palate, tongue thrust, crowded teeth, even a higher risk for braces with a tongue tie. I had braces 3 times and had to have jaw surgery. GI symptom like reflux and constipation, even in adults or children, we see often resolves. If I guarantee it, then it won't work though. But the take-home message is that symptoms change over time and they can certainly last a lifetime. So again, we have many adults or teenagers that have tongue ties, and they really need to be working with a myofunctional therapist to get the best results. So if you're not already, if you want, get yours done, for example, if you're a mom or dad, ask us for a list. We can help you find that. So why do we use a CO2 laser? So a CO2 laser is different than a diode laser. Not all lasers are the same. So if you just called up an office and said, y'all use a laser, they could say yes, and it could be a wide variety of things. but there's minimal to no bleeding. It's less painful than scissors or scalpel, shown in studies. Better visualization during surgery. You can see much better because there is that minimal bleeding. Extremely precise. It takes away the width of a human hair at a time, basically. Virtually no risk of infection. We've never seen one. There's no need for, again, sedation or putting the child to sleep. It's very effective. It works well. Healing and scarring is better compared to scissors or heat-based methods. So we use the highest quality CO2 surgical laser available, and it vaporizes the tissue instead of burning it like a cautery would or a diode laser would. It still has a little bit of a smell to it, just to warn you, but it's not like a burning. It's vaporizing. So it heats up the water molecules to the boiling point of water, and then it just turns to steam or vapor. I did achieve board certification in laser surgery as well as pediatric dentistry, and we do perform more procedures than anyone in the Southeast. So a few risks and benefits. So the most common to least common, of course, it's going to be sore, some discomfort. Minor bleeding is possible. Trouble eating could be there for a couple of days. Reattachment, it can stick back together. Oral aversion is possible, so we always try to do the stretches as respectfully and playfully as possible. But it can be difficult, especially with toddlers getting in there. That is difficult, so no question. You could certainly have injury to salivary duct or nerve. We've seen some people cut through with scissors accidentally, and then we had to go back and fix it, but they cut through the salivary duct. And then infection is certainly possible, but we've never seen one in thousands and thousands of cases. Benefits, though: better speech, eating, sleeping, so cutting down the time of speech therapy or feeding therapy significantly. Often you still need some kind of speech or feeding therapy we'll talk about in a second, but it can cut that time down dramatically. Better dental development, breathing, GI improvements, hopefully now and in the future. And of course, it's never a guarantee. If I guarantee it, then it won't work for you. But we always hope and pray for the best resolution for every family. During the procedure, we'll use a strong numbing jelly, and if the child's cooperative, typically 4 to 5 years old, like if they feel a pinch, they're not going to jump. We use some injected lidocaine as well. We do follow all laser safety protocols and use protective eyewear for everyone in the room. Procedure is honestly about 15 seconds for the lip, about 10 seconds for the tongue. And then, for older children, and then it takes a few more minutes to set up and position, take photographs. So the whole thing is about 5 minutes. But the procedure itself is very quick. Older children, adults, it could take minutes per area, just because we want to be real thorough and get it exactly, and they're obviously bigger. And then if we have to suture, so older children, like teenagers and adults, that adds about 10 minutes to the procedure. But most people are very comfortable and act like nothing happened. It's not a big deal. So ice cream, cold or soft foods, alternating Tylenol, Motrin for the first couple of days. That's the best thing to do afterward. Again, most children, like 3-year-olds, 10-year-olds, they do well, act like nothing happened, might be a little bit more quiet, a little bit more sore. Of course, while it's happening, the younger kids, they could, cry or something like that, have a harder time. About like if they fell down and bumped their knee, some tears, and then they calm down within a few minutes, and then they get in the car and they're good. Or go play on the playground. We have a playground here. Always encourage the patient to move the tongue as much as possible. That's helpful. See the speech therapist or myofunctional therapist as soon as you can after the release. That's very helpful too. You may have to bribe or positive reinforcement, like get a chart and mark off the days. And at the end of the week, if they do the stretches well, go to the zoo or something like that for the stretches, because it is hard to do the exercises. Or if you're an adult, you can bribe yourself, I don't know, whatever that looks like. Shopping on Amazon. With sutures, you can wait a few days, 2 to 3 days to start the stretches. So the first couple of days is when it's most sore, so that is helpful. But stretches are still necessary. And we'll talk about that in a second. And the sutures typically fall out on their own within 3 to 7 days. So stretches. So the parent have someone stretch the wound about 2 times a day for 3 to 4 weeks. If it's an older child, again, they understand what's going on. The last few weeks are not as sore. You could go up to 6 weeks to prevent reattachment or sticking back together. Adult, you might want to go longer too, because you understand the benefit of it. A toddler, shoot for 3. That might be all you're going to get, 3 weeks. Minimum once a day if they're super uncooperative, children on the spectrum, that kind of thing. Quality over quantity. For best results, though, definitely work with a speech or myofunctional therapist. In fact, we require teenagers and adults to work with a myofunctional therapist before they can even schedule an appointment. Myofunctional exercises about 2 times a day or as directed, so like the tongue left and right, painting the roof, gumball, clicking noises, like that. So working on those exercises, getting the tongue to move separate from the jaw. And they'll help you with all that. But it can get complicated depending on what the child's or adult's individual needs are. We see patients back at a week, 10 days or so. Most of them have lost some degree of mobility and they need a gentle, we're always gentle, but effective deeper stretch, and you'll see it stretch out. Might have a little bit of bleeding, but we're always gentle because it can stick back together. So reattachment is just a natural healing process, and what we're doing is we're trying to trick the wound to stay open. And it can happen easily if the stretches aren't performed routinely, so several times a day, or with enough pressure, because most people really do not push hard enough. You don't want to hurt your kid. I don't want to hurt them either, but we also want to make sure it works for you. So use gentle but firm pressure to ensure it's not sticking back together. If you have like a camping headlight, that can be helpful. You can see in there good. So stretch 2 to 3 times a day. Again, toddlers might only let you do 2. If it's an adult or a teenager, older kid, 3, shoot for 3 if you want to. But enough pressure and make sure it looks good. If you need to, you can do a deeper stretch to open it up again. There's a video on our YouTube channel, or if you come back for the follow-up visit, we'd be happy to do that. But we do understand a lot of people travel from a good distance, even other countries, to get this done. So sometimes it's hard to follow up, but make sure to do a deeper stretch. If symptoms come back after they got better, so like a child's talking better and then starts talking worse, the tongue could be sticking back together. That's probably the reason. So come back to see us or push harder on it. We can still even do a deeper stretch without having the laser again for about 3 or 4 months afterward. But after that, we'd have to laser again. And of course, as always, it's a team approach. We just do one part, but for successful symptom improvement, you have to involve other professionals as well, like a speech therapist, occupational therapist, can help with speech, swallowing, eating or solid feeding, other issues. Myofunctional therapist helps with tongue posture, swallowing, nasal breathing. A body worker like a chiropractor, a physical therapist, craniosacral therapist can definitely help baby or even adults and teenagers with any neck tightness or other issues. The pediatrician or the primary care provider for obviously routine visits, referrals to other specialists like sleep specialists or something. And if you need any referrals, please let us know. We can try to help you find someone in your area. I always call all the patients that night to check in. You'll have my cell phone number in case there are any concerns. You can always call our office. Let us know if you have any questions. Remember, it's a process. So often you'll see some improvement initially, like, oh my gosh, did he say like his L sound different? Like right when we left? That definitely can happen. But it could get more difficult for a few days as it's sore, and then hopefully gets progressively better over the next few weeks. So if at the 1 week check you haven't seen that many things yet, don't worry, you can still get some more things, especially if like the older the child is, the more bad habits they have to overcome those. There are a few Facebook groups. There's the Alabama Tongue Lip Tie Support Group for parents. There's state-specific groups. Again, we have people from other states. There's also Tongue Tie Kids, which is kind of a national group, or international group, and Tongue Tie Adults. It can be helpful too. If you're like, oh my gosh, can I touch my toes now? Like they can touch their toes easier. The Tongue Tie Adults group is definitely interesting. So we did write the book Tongue Tied several years ago, 2018 we wrote the book, sold a bunch of copies all around the world, and so we're proud of that. But it's available on Amazon or on Audible for audiobook. But if you want a copy for yourself or to share with a healthcare provider that you think might be interested and to spread the message, please let us know. We'd be happy to give you a free copy to pass on and to read yourself. As always, we're trying to help push this specialty forward, so we've published several articles in peer-reviewed literature to help other dentists and doctors and whoever else, speech therapists, to see that this is a real need and it has real solutions, and people can definitely be helped by the procedure. And then just put this slide in there because so all the money from the book, we don't keep that. All the money from our live course, we have doctors visit every month, and all the money for our online course, we've had hundreds of students take the online course to teach other dentists how to do the procedure. All that money goes into an account, and we give that all away to water well projects across Africa and Asia, health clinics in Asia, human trafficking projects, again, abroad as well as here and locally. So all kinds of different projects. There's probably about 15 different organizations we give that money to, but we try to give back locally and globally. And lastly, advocacy. Many parents ask what they can do to help spread the word. So of course, tell your healthcare provider the symptoms that improved after the release, whether that's the pediatrician or your chiropractor or speech therapist, whoever, let them know, hey, like we had this done and like this got better. Help friends who are struggling, because just because something's common does not mean it's normal. Just because a child has ADD or speech delay or they're snoring and poor sleep quality doesn't mean it's normal. It could be better. Also, consider making a social media post. Probably wait a few weeks just to see all the results, but maybe make a post about it and say, hey, get your babies, your children checked properly. And of course, again, if you would like a copy of the book, we'd be happy to get you one to pass on to your healthcare provider. So that's just a quick intro on tongue ties. Hopefully this was helpful for you. If you do have any other questions, please let us know. And thank you for trusting us with the care of your family.